to her risk. The risk of infection, the risk of bleeding, the risk of miscarriage, the risk of spontaneous rupture of the membranes was introduced right along with the laminaria. It's the laminaria that created the risk, not the other way around. But it would be prudent to have a consent form that just covers those things. There is plenty of literature support out there for removal of laminaria. I found a handful of studies, let's say, on this. There was a paper in 1987, American Journal of Obstetrics and Gynecology, entitled Successful Pregnancy Outcome After Cervical Dilation with Multiple Laminaria Tents in Preparation for Second Trimester Elective Abortion. Now, this was a report of just 2 cases. I thought they were interesting. Obviously, it's a small study. We're only talking about 2 anecdotal cases. But I thought it was really significant. One of them was 22 weeks pregnant when the process was begun and had gone through, as in the words of the paper, an extensive dilation already. Again, obviously, if laminaria is going to be removed, certainly sooner is better. But it can be removed at any point, as long as this patient does not show signs of infection, as long as the patient does not show signs of chorioamnionitis, as long as the patient is not bleeding. Actually, you can remove them even if she was bleeding, but certainly if she has any evidence of rupture of membranes. But unless your patient is showing any of those particular signs, proceed with removal of the laminaria. This was interesting to me, even though it was a small study. One of these cases, as I said, was 22 weeks pregnant. She had already undergone an extensive, that was the words of the paper, dilation with laminaria. She happened to be a heroin addict, and she had had a total of 12 laminaria tents used over a 2-day span of time. Changed her mind about the abortion, and these were removed by a physician when she had changed her mind on the abortion. She went on and had a perfectly normal term delivery with no complications whatsoever. The second case in this series was a woman who had already had 2 miscarriages, and again, pretty much the same thing. 17 tents had been used over a 2-day span of time. We're talking, this is how much cervical dilation we're talking. We could have the cervix dilated several centimeters at this point. Yet they were simply removed. She was put at bed rest, started on antibiotics, and again had a full term delivery. The second case, she was dilated a full 3 centimeters, my 2 finger breadths, prior to removal of laminaria tents. The cervix spontaneously regressed back to normal, being closed within a week. She was checked occasionally. She was returned to normal cervical closure within a week with no complications of infection, bleeding, rupture of membranes, and went on and had a perfectly normal term delivery. The second review I found was in 1991, entitled Outcome of Continued Pregnancies After First and Second Trimester Cervical Dilation by Laminaria Tents. This was the biggest study I found. 21 women were included in this particular, we're talking about in this paper. 7 were first trimester, 14 were in their second trimester. Laminaria was inserted for induction of elective abortion, obviously. Of that group, 17 continued their pregnancies. 4 had changed their minds, had the laminaria removed, then changed their minds again, went back for laminaria, and then ended up having their abortions. But of the 17 that had changed their mind, 14 went on to full-term delivery with no complications. 2 delivered premature children that survived and did well. 1 was a spontaneous abortion following removal of the laminaria, about 2 weeks later after removal. I was intrigued by that, though, because they said the spontaneous abortion was at 10 weeks. And that was 2 weeks after they inserted the laminaria. So it struck me as that funny that somebody was using laminaria that early in pregnancy, but they did. So the point is here, an extremely high rate of success with full-term, totally healthy children after removal of laminaria, with little to no complications. Last paper I saw was just last year, Pregnancy Outcomes After Laminaria Placement and Second Trimester Removal. This was just 4 cases, so again it was a small observational paper. All 4 cases were between 12 and 17 weeks of gestation. 2 laminaria was removed. 2 of them were full-term deliveries, no complications. 2 of them did develop chorioamnionitis and had deliveries in the second trimester, but again, unless I'm reading this wrong, both babies survived. So the point is, there's literature support for removal of laminaria. So if you're in a situation where you have, where someone's requesting removal, you don't have to get that uncomfortable feeling like you're off an experimental bill. It certainly has been done, it certainly has been written about, and you can say, look, there's literature support for removal of laminaria with an extremely high rate of success. One problem that you can, fortunately it is uncommon, I'm happy to tell you I only ran into it once in all the abortions that I performed. But one problem, laminaria, as I said, laminaria removal is usually very simple. Grasp a hold of the strings of the laminaria themselves. You have a speculum, you can see the cervix, you can see the laminaria. Grasp hold of either the strings or the laminaria itself, usually with a ring forceps. Gently and steadily extract them, and the job is done. As I said, I would put them on antibiotics. You want something obviously safe in pregnancy, so I would probably pick Cipro and Flagyl for 5 to 7 days. And then just have them rest for the next day or two, allow the cervix to come down. And other than that, the patient doesn't have to be restricted in terms of activity. Laminaria removal usually is very, very simple, and it's not technically difficult. There is one possibility, and I did run into this with one of my own patients, called hourglassing. Hourglassing is nasty. In this case, most of the time, the vast majority of the time, the laminaria dilates along the entire length of the laminaria tent. It dilates uniformly. You've got the same diameter along the entire laminaria tent. I ran into one case, and there are other cases described in literature, of what's called hourglassing. And what happens is, and I don't know why this happens, if it's a defect in the laminaria, or more often maybe a more rigid cervix. The laminaria, of course, the cervical canal is several centimeters long. The laminaria tends to be a little bit longer. And what can happen, unfortunately it's rare, as I said, in 1,200 abortions and the hundreds of patients I use laminaria, I only had it happen one time. But what will happen is it won't dilate evenly. You get a lot of dilation at the ends of the laminaria, but the center stays relatively compressed. And you end up with almost a barbell effect with the wide ends where you don't want them on the inside, just inside the internal os and just outside the external os of the cervix, with this compressed laminaria in between. Now removal is not so simple and can be very difficult. I would not suggest, the basic message here is if you're encountering resistance on removal of that laminaria, stop. You need to get an obstetrician. If you're not an obstetrician gynecologist yourself, you're going to need to get an obstetrician gynecologist to take those out. It's rare, as I said, I only saw it once in those 1,200 cases, but it can be very difficult. I struggled to get those laminaria. I had 3 of them in one patient, and really struggled. I was able to remove them, but it was not easy. I came across a case in this literature search of a 17-year-old girl that had laminaria inserted. This hourglassing effect had occurred, and in the end, the only way that it could be removed was a hysterotomy, which means essentially completing the abortion. They had to do the hysterotomy just to get the laminaria out, much less the pregnancy. So it can be difficult, but fortunately, it's a very rare occurrence. That's my message today. It's pretty simple. As I said, you've got literature support. You're not out in the woods when this occurs. It is not a difficult thing to do. There is enough literature out there to tell you that the vast majority of these pregnancies will proceed without complication. These do not cause, quote, birth defects. We're well beyond the stage of organogenesis when these procedures are being done. Laminaria removal can be difficult, but fortunately that's a rare occurrence. Go ahead.
In regard to the laminaria that's been inserted, the woman has now had a change of mind, seeking to have the laminaria removed. We will assume that the woman does not return to the clinic where the initial laminaria was placed, feeling that they're not going to help her with her change of heart. How long can a woman do these continue to expand if they choose not to go back?
That's a great question.
Period of time. How much time do you have? What time frame are we talking about?
That's a good question, because it brings up your question. It may be what you're thinking of, but it give me the thought, geez, if I was thinking, do these things just keep growing and growing and growing indefinitely? What happens if she comes in 3 days later?
Exactly.
My gosh, how big are they now? No, the answer to that is the dilation of the laminaria is let's call it a self-limited event. What dilation is going to occur has typically occurred after 8 hours. I've seen hundreds of these. When you do a lot of them like I did, you get used to seeing them. As I said,